Hi, I'm Asa, the content director of Academy of Therapy Wisdom. So I film all of our courses, and I want to talk about another one of our courses that I think is underappreciated. All of our courses are good, and one of those is actually two courses, both by Kimberly May. Now, Kimberly May does harm reduction-based addiction therapy. Now, if the word addiction makes you think about clicking off of this video, hold on for a second, because the biggest underserved population in psychotherapy is people who struggle with problematic substance use. A lot of therapists have been trained that when somebody is addicted to a substance, you have to send them to an addiction treatment, and you shouldn't try to treat that in your own practice. I don't know if you're someone who's learned that or not, but the problem with that is that addiction treatment is either going to a very expensive private residential treatment that a lot of people don't have access to, or going to an overworked public addiction treatment center that just doesn't have the resources to handle the amount of people who have some kind of problematic substance use. And the other thing is that a lot of your clients that you already have probably engage in some kind of addictive behavior, whether that's scrolling social media, adult content websites, video games, or some kind of substance. They may be using alcohol in a way that doesn't qualify as alcohol abuse disorder, but is somehow interfering with them living the life that they want to live. And so I personally think it's really important that every therapist learn something about addiction and learn something about substance use. So Kim has two courses. One is called Substance Use and Addiction, and it's about what are the different substances that people use, and how do they use them, and why do they use them, and what is the effect. And just so that if a client comes in and says, or if a client you've had for years says, I want to let you know, I think I'm having some issues with prescription medication, or I'm starting to have people tell me that my drinking is a problem, or I've been using benzodiazepines, or whatever it is they say, you have some knowledge of what that substance is and how it works, and also how to approach that in a way that's not all or nothing. So the other aspect of what Kim teaches is that it's a harm reduction approach to addiction therapy. You may be familiar with harm reduction in the public health space, providing needles and stuff like that, but there's a whole therapeutic modality around it that involves meeting the client where they're at and not insisting that they have to be in a particular place in order for the therapy to be successful. So she gives a great example of a guy who was, his family was telling him he needed to stop drinking. He didn't want to stop drinking. And so by meeting him where he was at, she gave him options of, you can actually reduce the amount of risk in your drinking without stopping. So he stopped, by working with her, he stopped drinking and driving. He started to monitor when and how he was drinking. He stopped drinking before the evening. Or a woman who was drinking all the time and scaled back to not be drinking when she had her kids at home. Now, just imagine the effect in the life of those kids, of her making that change, which is, it's not total abstinence, but it still makes a huge difference in people's lives. So her other course is specifically on a harm reduction approach to treating addiction. Another reason that I love this course is that Kim went above and beyond in preparing for this course. Most teachers, they'll show up with their PowerPoint slides and they'll have their PowerPoint slides in front of them and they'll just go. And whatever comes out, comes out. And we work with teachers who are very experienced, so what comes out is good. But Kim, she scripted out every single video and she practiced every one and tracked how long is this video. We try to break all of our courses down into small chunks so that it's easier for you to fit into your schedule. And I tell presenters, 7 to 15 minutes, roughly. That doesn't always work out that way. Sometimes it's 20, sometimes it's 30. I'm kind of loose about it. But Kim, she made sure every single video was in that range of 7 to 15 minutes. She practiced, she edited, she practiced, she edited. So by the time she showed up in the studio, this course was dialed in. Every word is in there for a reason, so that this course won't take any more time out of your busy life than it needs to. So I hope you'll check it out. We'll link her 2 free videos underneath this one, and I encourage you to watch them. Both of them have great stories about clients that she helped. Another hilarious thing about Kim, when she was first coming out of grad school, she didn't know what she wanted to do. She talked to somebody who was working at an addiction clinic, and she asked what it was like. He said, it's like doing therapy on a pirate ship. And she said, I don't know what that means, but it sounds amazing. I want to do that. So she is somebody who will just step into the breach and work with people no matter where they're at. And just a wonderful person to learn from. Another funny story about Kim, no matter how hard I tried, I could not get her to give me a fake smile. So every smile you see in her course is real. And so I hope that you'll check out both of her courses. We'll link her free videos in the description of this video, or maybe up on the top, so that you can check it out and see if one of these courses is the next step for you.